Always something with TikTok. Oh, available networks. Ouch. Hey, good evening, Brother Van. How are you? I'm trying to post up on. It won't let me go live because it's telling me that I don't have any internet. I don't want to do any of that. I want to get the internet on here. Good evening, everybody. There's always something up with TikTok. I don't know what it is. It's always something up with TikTok. It's saying that I don't have any internet service, and I know that's not true. My server is right next door to me. It's right in the next room, directly there. But I digress. I'm not that computer savvy anyway. I know what I know, right? You know what you know. And I apologize. I did put the midweek refuel chart up there. Um, I normally hit it and send it to everybody. This time it didn't send to everybody. So I just posted on um, the Trampoline page. I believe it should be on my personal page. And I did put it on YouTube kind of late. But if you want to give a shout out, what are your we'll do the midweek check in a minute. Just in a minute. I am so done with this thing. I don't want to screencast anything. I forget why it's not having available networks ready. This is a new tablet I'm having problems with all the time. Give me a second, guys. I really apologize. In range? I am in range. What are you talking about? So we got connected. Let's go back. Scan your QR code to another device to join the. Well, I don't need to do that. And I'm about to give up on him. I don't know what's going on. Hey, Miss Carla. My tablet's messing up again. And I don't know how to fix it. Well, TikTok won't be on tonight, right? Because I'm tired. This pisses me off. Came up early to set everything up. It was set up, and now it's not set up, and I don't know why. I don't know why. Let's do our midweek check-in. Mm, let it rise. Rise among us. Let the glory of the Lord. It's not going to do it. I can't. Yeah. Good night. Good night. Good night. I'm not. Oh, Miss Carter, you threw some. I needed some humbleness there. I'm sorry, guys. I came up early and it was set up, and then it didn't get set up. I'm not going to worry about it. TikTok is not kind to me. I don't know why. It must want me to be on here with my face and giving this free information. But anyway, good evening, everybody. This is Kimble Evans. I'm your trap therapist, and you are on the Trap Lounge for maybe an hour with me. I had a guest on, but their schedule changed, so you'll see me tonight. It'll be okay. It's an interesting topic tonight. But let's do our midweek check-in. I put up that I'm doing great. I am doing great. I am officially a home owner. Hey, hey. Thank you, Lord. Thank you, Lord, for this opportunity. I've been living in my house since 2007 and just signed some paperwork today. It's all mine. And even got a little bit of change back. Yes, 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 yes. It's officially, it belongs to me and only me. So I'm doing great. I'm doing great. I'm happy about that. All the other legality stuff out of the way. When you get divorced, you got to go through all the stuff. But I own this own now. It's mine. So I'm feeling great right now. I'm trying to get up on some things. Got some projects coming up. I'm still writing this third book. It's kind of slow, but it's going. It's going. It's going. So if you're doing great, put up some red emoji hearts. If you are doing okay, this is blue. It is not purple. Put up some blue emoji hearts if you're doing okay. Yellow, mellow, yellow, meh. You're not doing too well, but you're still there. Put up some yellow emoji hearts. If you're having a tough time and you're struggling, put up them green emoji hearts. If you're having a tough time and struggling, put up those green emoji hearts. This is purple. If you're having a hard time and wouldn't mind if someone was to reach out to you, put up the purple emoji hearts. If you're having a tough time and wouldn't mind if someone reach out to you, again, I read my DMs every day. I mean, my emails every day. Talk to me if you have any issues. If you're really in a really dark place, this is our broken heart emoji. If you're in a really dark place, talk to me, DM me, inbox me, message me. I'll get right back to you. I check it every day. If you're having harmony and balance in your life, throw up that pink heart emoji. Orange and harmony and balance in your life, throw up the pink heart emoji. If you're feeling optimistic and uplifting, here's that orange heart emoji. If you're feeling optimistic and uplifting, orange heart emoji. I said I grab this every time on the smile. If you're having a day like this, put up the brown heart emoji. A day like this, put up the brown heart emoji. I can probably say Zeus had a day. No, it was yesterday. A day like this. He that dog is so smart. I told him, do not eat the cat's food. And he's looking at me. I said, Zeus, I'm going upstairs to the bathroom. I'm not going to be long. I'm not tying you to the banister. I'm not doing that. Don't eat the cat's food. Come back downstairs. And I know when he does something wrong because he gets real low. And his eyes get big. I said, what did you do? I went in, all the cat's food was going out the bowl. No, my cat do eat her food, but not that quick. So I looked at him. I said, you know what? I used to slap him in his mouth. Pop, 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 pop. Like a baby. Pop, 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 pop. I said, I ain't going to do that. You ain't getting no food. You're not going to eat till like 4 or 5 o'clock tonight. My dog greedy like I'm greedy. He was mad. My husband was eating his chicken and he was just staring at him. So he had a day like that yesterday. Miss Carter threw up them great emoji hearts because she's feeling cool, self-restraint with a little bit of humbleness. I had to get humble with TikTok, but they listen. That's on another level right now. TikTok's on another level. If you're having some mixed emotions, some blankness, and you wanted to do minimum today, but you made it through the day, throw up them white emoji hearts for me, people. Throw up the white emoji hearts. We have our light blue emoji heart here. If you're feeling friendly and relaxed, the light blue emoji heart. My black is missing. Wait a minute. Where they at? I want y'all to see my bum. That is totally weird. That is totally weird. My black heart emoji is not in the canister. Well, it is a black emoji. It's for anger and sadness. That's really weird. The last one is for frustration. This is our flaming heart. If you're feeling frustrated today, this is our flaming heart. Throw up the flaming heart emojis. That means I'm gonna make another one. Wonder where it is. Mysteriously disappeared. Okay, today, guys, I believe I did a live like this probably the first year. This is my almost my fourth year being on here. Maybe my third or fourth year. And I talked about this before. I called it labels. The stigma with mental health labels. But today, the topic is, what did you call me? Negative stigmas. What did you call me? And I got this idea because I know the week before last, someone was having a problem because somebody used the word crazy. And a lot of people don't like using those stigma type words. So I just wanted to come on here because I do not attach myself to my mental health illness. I'm not depressed. Those are times, episodes, and moments. I'm not like I don't want to attach myself to being a pre-diabetic. Matter of fact, I don't even want to be in that category at all. And so things like that, people get negative, this stigma about, and I think it comes from society. From society. So I looked at the word stigma, and it means a mark of disgrace associated with a particular circumstance, quality, or person. In the Merriam-Webster dictionary, it says is a set of negative, unfair beliefs that a society or a group of people have about something. So, or something, and I would say it's two issues because both issues are different. You have mental health, and then you have mental illness. They're both different things. It's a mark of shame or discredit, like a discredited or like a stain. You know, a stain, you can try to get it out, bleach it out, shout it out, soak it out, but that stain, might get lighter and lighter and lighter, but you can still see it's there. This is the same thing with mental health and with mental health illness, but they're very close, but they're two different things. It can be an identity or a mark or a characteristic. It can be a specific diagnostic sign of a disease. Now, would you? And I think this is why they're trying to cover this, or they've been covering it for so long. Mental health and mental illness or mental disease. Imagine you going to the doctor and they're giving you an evaluation and everything's fine. You may be anxious about some stuff, and they say you have anxiety disease. You're like, what did you just say to me? I got a disease. Hey, Miss Lawson, I want to go to your thing on Saturday, but I have a going home gathering to go to. Oh, I want to go. Maybe I'll send my husband down the street. It's at the library. Put the information in our chat so everybody can know about it. She has a gathering on March 28th at Alame's Library. Alame's Library, and I want to go so bad. There's another one coming up in April. I'll be at that, but I'm not sure. But so imagine going to your doctor, and even for anything medical, diabetes is a disease. There's certain words and certain languages you use with people, and if you don't understand those languages, especially when doctors use really big words, we don't know what they mean. But now we have WebMD, and you can Google stuff now, right? Like I went to school, I got all these psychiatry books and this book, I got the Freud Book of Dreams and all this stuff. I got the DSM-5, all these things. And that has so many big names and big terms in there. Yeah. I don't use them terms because I don't know half of the times what they break down to what they mean. I want myself breaking down to me in a simple language. That's why I turn and twist things, and it's the trap language. That's why I got the name trap therapist. So I'm gonna give you like 3 scenarios where you can say or you can think about, because this has happened. I told my daughter this over when she was here today. You can think about the negative stigma. There is a social stigma attached to receiving welfare. Now, I told my daughter today, I said, not so much today. Because you go anywhere, everybody throwing their EBT card out. Now, back in the day when there were food stamps, the little book, you had the food stamps, if your mom ripped off a couple of food stamps and told you to go to the store and get some food or whatever, you waited till everybody got out the store because you were ashamed of being on government assistance or public assistance. But now, people be throwing them EBT cards, honey. But the society says that whoever's on welfare, we see this, we think this, they're uneducated, they're lazy, and push comes to shove, they think it's all people of color. That's the stigma behind government assistance. A person seeking treatment for addiction. They call it a disease now. It's a disease of the brain. When you're adding these chemicals into your body, it messes up the neuroreceptors in your brain, the dopamine in your brain, and it's a disease of the brain. But the negative stigma behind people seeking treatment for addiction is they can stop on their own. Can't. It's hard. It's a real struggle. You can stop on your own. You can be sober for years. You can be sober, and you can have a relapse. A lot of people that don't know, how addiction works and the mind and the chemicals. Because I was like that one. That's why I didn't take that track in school, because I had a thought like, listen, if I can stop smoking, if I can stop drinking, if I can stop partying, everybody else can do it too. But it's not absolutely true. Different circumstances, different life situations, different experiences. It's difficult. And the other stigma is mental health. People have a fear of anybody that has mental health. Bipolar disorder, mental health or mental illness, bipolar disorder, personality disorder, schizoaffective disorder, all these disorders. It has a negative stigma around it. The person that has a mental health illness is a violent person. It's not true. And everybody that has a mental health illness is a violent person. People that have a mental health illness are dumb with it. They don't really know anything. They need a lot of help in, taking care of things. That's not true. We have people that's in office and the Senate and hospitals and teachers and nurses and even some psychiatrists and therapists that have a mental health illness and they function perfectly fine. So I'm going to talk about mental health stigma, and then I'm going to talk about mental illness, the stigma, because remember, there are two different things. They push these things together, and we think they're one. They're not. They're not. So mental health stigma involves judgmental attitude and discriminatory behaviors towards people with mental health conditions. Hear that? Conditions. They're often stemming from misunderstandings or lack of knowledge. This prejudice causes deep shame, isolation, and reluctance to seek care, leading to reduced self-esteem and fewer opportunities in housing and in employment. Now, the lack of awareness or education regarding mental health conditions. Inaccurate, they sensationalize or stigmatize the deceptions of mental health illness. You see how it keeps switching up in the news or into entertainment, like with the mental health illness, the famous couple that passed away, that the son unalived them or killed them. He does have a mental health illness, and he was saying because he wasn't taking his medications properly. Maybe it was in an episode of his illness that he killed his parents. And I was like, that is bull malarkey. Because again, if you want people to believe this, put it out there. He only went on a rampage because he had mental health illness and killed his mother and the father. That's malarkey. This man had other, I would say, dual diagnosis. And what a dual diagnosis is, two things that collaborate that have a problem together: his mental health illness and his substance use. He was known for having substance use. He would relapse and get back and relapse and get back. So taking the substances and not taking his medication heightened all the other things, the symptoms around his mental health illness. So the media, even the news, will try to put in your mind that people with mental health illness are violent, they commit crimes, they just, maybe some of them are just, drug seekers. And that's not absolutely true. So fear and misconceptions that people with mental health illness, again, are violent and dangerous. Do I look violent and dangerous? I was diagnosed with depression in 2001. Look how many years ago that was. And I can say at that time, in that experience, and in that episode, I was very depressed. I had just gotten married, 21, and not a year in were we separated. Now, prior to that, we lived together for 6 blissful years. But a year into us being married, so from turning from 21 to 22, and I had 2 kids. Can you imagine, like, not having that help and assistance anymore? So I was diagnosed with depression in 2001. But I don't look violent or dangerous. Mental health illness involves negative stereotypes, prejudice, and discriminatory behaviors directed at people with mental health, watch it, conditions. You see how they interchange them? And if you remember back years ago on my show, mental health has to do with your thoughts, your feelings, and your emotions. Mental health illness, it has to be diagnosed by a professional. So they interchange the words and it confuses the people. Often leading to shame, isolation, reluctance to seek treatment. So if you have, if you're going to your doctor and your doctor says you have mental health illness, it's going to scare you. If your doctor is saying that you're having difficulty functioning with your mental health, it's going to scare you because you have already heard or seen that it's stigmatized in the world. So people have a reluctance to seek treatment. They create significant barriers to recovery and overall their quality of life. So if you have a mental health illness and you're not getting treatment, and treatment does not mean taking medications, people. There is no magic pill to make something go away. I wish they had one for these hot flashes. I'll tell you that. I'll tell you that. Give me a pill for these hot flashes. We'd be perfectly fine. So stigma causes people to hide symptoms or delay or discontinue treatment. And they suffer from isolation and silence, and it hinders employment, housing, and social inclusions. When someone is diagnosed, or when the doctor is asking the PH9Q questions, they ask you how often you feel sad, depressed, or whatever. How often are you anxious? They'll give you all like 9 questions or whatever, and they'll tell you, it can be half of the days, more than half of the days, every day, or never. They do it really quickly down in the doctor's office. The nurse will come in and ask them questions. They'll say, have you felt sad in the last couple of days, 2 days? I felt like you have to get out of bed? All these things. How often? They already gave you a mental health screening, is what they call it, a quick mental health screening. And depending on how you answer those questions, when a doctor come in, the doctor will ask you what's going on. Do you feel any depression, any anxiety? They'll look in your chart to see if you had any past history of any of that, or if there's any family history of mental health illness. And they'll talk to you about it. If you say yes or no, hey Dalia, if you say yes or no, then they will say we can recommend you to talk to someone, maybe a therapist, or maybe go to a psychiatrist, because then the psychiatrist is going to diagnose you possibly with the mental health illness if there is something. Now, this is the part where the trap comes to me at. Again, I went to school for this, guys. I have my master's in psychology. I have a BS in behavioral health sciences. This is where the trap comes into me at. Because when I used to work in outpatient services at the Wedge is no more. Okay, so I can say it now. Okay, I used to work at the Wedge in outpatient services. At first, I was working on Broad and Rockland, the one at Broad and Rockland, and then I moved all the way up to the one on 6701 Broad Street. At Broad and Rockland, I was a fee-for-service therapist. So I had clients. By the time I moved up to 6701 Broad Street at that Wedge, I was the clinical assessment specialist. Different jobs. The clinical assessment specialist, I do all the intake. So before you even see a therapist or a psychiatrist, you're coming to me and I'm getting all your history. The reason why you're coming, what's going on, what do you think is going on, your symptoms, your family history, your childhood history, all those things. I'm gathering all that stuff, supposed to be in 1 hour, and then you're supposed to get a diagnosis. Now, the difference between you going to your doctor, your physical doctor, you saying you're having problems, you got some swelling in your feet, you have slight headaches, you see circle in front of your eyes, your doctor is going to go and take some blood. And when they're taking the blood, they might take some urine and dip the little urine in the thing to see if your potassium high, all those other things. And they take their blood to a lab and they run tests. And they'll run a test for maybe your thyroids. They'll run a test for your thyroid, your panel. They'll run tests for diabetes. They'll run tests for cholesterol. Whatever the doctor put on there for them to take all those vials of blood that they took from you, they're running tests on. The doctor sometimes will say, well, since you have a history, they'll give you a dieting program, or say eat less salt, eat this, whatever, and write down what you're cooking for yourself, because now you got to get them some more information about it until the blood tests come back. The blood test may come back that your AC1 is high. Your AC1 is high, so now you're in that category, pre-diabetic. You got to watch your AC1. Your cholesterol is a little over the average or normal thing. So your doctor might say, you have a little high cholesterol. Let's try to get your LCL levels down, or they might want to put you on medication. It's totally different. The AC1 for that. Yes, Delia. It's totally different from when you're going to a mental health outpatient place, because you're talking to somebody for only an hour, giving them all your information. And this is the part I don't like. I didn't like it. I was there for 6 years. I didn't like it because once that person left my office, after I turned my report in, once I turned my report in, that last page, they asked you to give a diagnosis. You have to give a diagnosis because now we have to bill your insurance with a code. Now, I'm not a doctor. I have the skill set to know how to do a biopsychosocial examination. That's why they put me in that position. But I felt sometimes uneasy giving, especially children, a diagnosis. Because if you go from the Wedge to Warren E. Smith to Consortium to JFK, any other outpatient service place you go to, your diagnosis follows. Just like your medical stuff. If you go from Jefferson to, well, Hanneman's not even open anymore. I'm sorry, guys. If you go from Jefferson to Jeans, they'll look up your medical records and your medical history will follow you. See how the words are different? You have a medical history, but for mental health, your medical illnesses follow you. And you can go to Warren E. Smith and somebody over there can diagnose you with something differently from what they've seen over in the Wedge. So now you got another diagnosis attached to you. And then by the time you see the psychiatrist looks at that biopsychosocial report and they'll say, okay, yes, she has F20.9, which is what was F20.9 is major depressive disorder unspecified. And they'll code it that way. And then now your insurance is billing for major depressive disorder unspecified. And then the psychiatrist may or may not put you on a SSRI or antidepressant medication that day. So there's a lack of awareness or education regarding mental health, what that is, and mental illness. So mental health versus mental illness, because it's a fight. It's a fight. Now, no one likes, yes, the ICD-9. Mm-hmm. No one likes any mental health illness or mental health condition. No one, when you talk about it, people shut her up. And this is why I wanted to go over this again this night. Because if you guys can remember, if you watch the news, everybody watches the news sometimes. I don't watch it often. Number 40, is he 47? He's number 47, right? He's number 47. It's not number 48. Number 47, our president, he came on there, and since half of his fiscal year is over, and he was doing, another telling us, the people of the United States, what he's going to do more. One of the things he said to help out with mental health is to open the same asylums again. And I was like, wait a minute. We don't need another Barberry. We don't need another Norristown Psychiatric Hospital. We don't need those asylums to open back up because it locks people in there, and they were very mistreated, very abused, very over or underdiagnosed, and very over or under medicated. But if you bring the same asylums back, now you have doctors and you have nurses and you have orderlies and you have grants and funding to give to these people. These people is the constituents that have groups and say they have plans and stuff like that. I don't want to send asylums back. It's to me bad enough the crisis response centers that we have here in Philadelphia, and I'm going to say it ain't worth cookies. Some of them, depending on the shift, depending on the staff, depending on who's there, and I'm going to name one. Friends Hospital. Disgraceful. Disgraceful. On different days, maybe on a Friday or a Wednesday, Friends is disgraceful. Ah, yeah, Friends. Disgraceful. Disgraceful. When people get taken in, they be like, well, when they call and say, I don't want to get taken to Friends Hospital because the way they treated me there, I didn't like. And see, our calls are recorded. I ain't trying to get fired. But I to let them know, I understand what you're saying. I'm going to put this in your note because it depends on what part of the city you live in to see for whatever crisis response center you go to. It go by several different zip codes. So if you live over here past Roosevelt Boulevard or near the Northeast, they will take you to Friends Hospital because it's the closest crisis response center to you. North Philly, they're going to take you to Temple Episcopal on Lehigh Avenue. They do have a psychiatric floor at Temple Hospital, but there's not a crisis response center. So they might have an on-call psychiatrist if you go to Temple Hospital, if you're having a mental health breakdown or condition, or something like that. Now Einstein is Germantown, Logan, Albany. What Episcopal is worse than Friends? Lord have mercy. Let me tell you, Mr. Leah, my mom was at all of them. My mom was at every last one of them. And this was when I was younger, 12, 13, 14, going to every last one of them. Jeffrey is the one on 8th and Girard. It's not called Jeffrey anymore. Now, Belmont is not a CRC. Belmont is actually a facility after you stay at the CRC and you need more treatment than the 72 hours. They ship you to Belmont for more treatment. Now I'm getting off topic, but yeah, Belmont is an actual facility for inpatient treatment for a long stay. So often mental health and mental illness is used interchangeably in everyday conversations. They are distinct and important concepts, but they overlap in understanding, and their differences is critical. Critical is important. The differences is very critical. Everyone has, listen, guys, everyone has mental health. Every single person, babies, the elderly, them feisty little teenagers we got, or even them adult children we have. Everybody has mental health. It's like everyone has a physical health. You have mental health, but not everybody experiences a mental health illness. You get that? Distinction, it can significantly change how you understand and address various mental health issues. Now, why does it say that everybody has mental health? Mental health refers to our emotional, psychological, and our social well-being. How we think, how we feel, and how we act. How we think, how we feel, and how we act. That's mental health. It determines how we handle stress or relate to others, and it determines how we make decisions. Good mental health means being able to realize your potential to cope with normal stress. We can cope with normal stress. Your kids get on your nerves, that's normal. The job get on your nerves, that's normal. Your fiance get on your nerves, that's normal. That's stress. Arguing, fighting with the kids want this, they want that. You know, you don't have the money for it. You always ask me for stuff. Get a job. That's stress. But the thing is, common daily life events and challenges that trigger natural physical and mental responses, like work pressure. Again, you at work, you got deadlines. You're a supervisor, you got deadlines. If you're at work and you're a CNA, you got so many people that you got to take care of. That's pressure. Those are deadlines. Financial worries, relationship issues, health concerns, commuting. that's a mental health concern. Major life changes like moving from one place or one state to another, or even getting married. That's mental health. Those are things that's in mental health. Good mental health allows individuals to function effectively in daily activities and builds healthy relationships, and they're able to adapt to life changes. So we have mental health. We do it every single day when you wake up in the morning. How you feel, how you think, and how you act. I don't feel like doing this today. I don't even feel like going to work. That's the mental health issue. It's a mental health issue. These kids getting on my nerves. They making it not too easy for me. That's a mental health issue. Now, mental illness is a specific diagnosable condition involving changes in your emotional thinking or behavior that can be associated with stress and problems functioning. That's the key word. How you function in social, work, family activities, all those things. How you function at work. You can have that stress, but now it's elevated. So you're being late. You're not making your deadlines. You're calling out. You're real anxious. You're real sad. You're real slow, and you're not motivated to go. Your work and your daily life starts to fall apart. Mental illness is not universal like mental health is. Not everyone experiences a mental health illness. If you don't hear anything else I'm saying, when you think of mental health, again, think of it's how you think, how you feel, and how you act. Mental illness is a specific diagnosable condition involving changes in your emotional thinking and your behavior when you're not able to function like a normal person. And that's why they do them tests. And that's why I say when you're going somewhere, to your primary care doctor, to your OBGYN, it can be your neurologist, it can be your cancer doctor, oncology. If you're feeling trapped, if you're feeling sad, if this, I don't like poking myself with needles. I don't like taking needles at all. That's why I'm so anxious about not getting a diagnosis of diabetes. My mom was a diabetic. My grandma was a diabetic. My uncle was a diabetic. I don't want that. My mom took insulin. I don't think my grandma took insulin. I think she was on metformin. I'm not sure about my uncle because he passed when I was younger, but I know he had diabetes. I don't want to stick myself with a needle every day. And my ex-mother-in-law, she had diabetes. Let me see what Delia said. I'm going through some me. What did she say? Me talking mental health struggles now that I'm weaned off my Klonopin. It's rough, but my pain doctor doesn't want me to. He doesn't want you to he doesn't want you to not take the medication, or he's telling you not to take your medication. And see, that can be another topic, Delia, because I'm not for medications and I'm not against them. It's whatever your personal preference is. I just think once you start taking them, because it goes together with the chemical imbalance in your brain. Once you start taking them, you just can't take yourself off them. So if you're weaning yourself off, go back and forth with your doctor about it. And the final answer and the final thing is up to you. It's you, it's your body, it's your mental health. So I'm not for or against medications. It's just when you're deciding like I don't want to take this anymore. Go back and forth with your doctor. This is the reason why I don't think the medication is good for me. I've been on it too long. It's not really helping me. And you want me to take it for what? Because doctors, and I don't care what doctor is, I say doctors, your primary doctor, your neurologist, your oncologist, your OBGYN person, a psychiatrist, a psychologist, whatever doctor, they aren't curing any condition or illness. They're just treating it. So hence you keep going back and forth to the doctor. Because at one point in time, I had to go to my doctor every month because 2 years ago I almost had a stroke. I'm too young to be stroking out for anything. My blood pressure was off the hinges. And I was like, you're not up in my medication. We're not doing that. So she was like, okay, this is what we're going to do. We're going to monitor your blood pressure every month. You're going to come in here. I had to write down what I was eating. I had to write down if I was stressed out at work. And then we got to the source of why my blood pressure was going up, honey. But she didn't up my medication. So I had to let a lot of things go in my life, a lot of activities. And you know when somebody says, I told you so, that somebody was my husband. You do too much. So I had to make a balance in my life so I can function normally. Diagnose disorders with standardized criteria caused by many factors. It can be generic, it can be brain chemistry imbalances, it can be trauma, it can be environmental stresses and life experiences. 1 in 4 adults experience a diagnosed mental health illness each year, but this requires a professional to diagnose you. It requires a professional. I remember before I already had the diagnosis of depression, and when I used to go to the psychiatrist because I wasn't taking medications. I was like, I'm not taking any med. I have to be fully alert at my job. I have to be fully alert, and even now I have to be fully alert. So I used to tell him like, I think I got OCD. And he would listen to me. He was from the Philippines. I loved him. He's not even, well, no one's at that place anymore. And he would say, well, tell me, why do you think you have OCD? And I say, because I clean everything. I'm always moving stuff. I like things in particular order. It gets me anxious and nervous. He says, but does it delay you from doing your daily tasks every day? And I was like, I don't think so. And so he said, write down again, because again, you have to have a good relationship with your doctor in order for them to understand what you're going through, what you want to be, what they're going to diagnose you with. Some people have a ghost mental health illness just for a check. There are some kids that's grown now. Some of them wanted to be in the military. Some wanted to be Marines. Some wanted to do some, go for the FBI. They can't because they have a mental health diagnosis. And a child, now they've grown. So, if you have ADHD, inattentive, or hyperactivity, and you're going to be a FBI agent in the service, a Marine, or anything high in their functional level, they're going to deny you. And see, mothers didn't know that. They damaged their kids. And now those kids were now adults saying, I don't even know why I didn't get the check. I don't even know why my mom did this to me. I wasn't taking the medication. And wait a minute. If you 302 your family member, they no longer can bear arms. If there's a 302 in your medical record, you cannot own a firearm. Ever. Ever. And when you see it on the news, they be like, well, how did this person get a firearm when they had a mental health illness or condition? Like the guy that killed his mother and father. How was he able to go get a weapon when they knew he had a dual diagnosis? He had mental health illness and he had substance use, chronic history of it. The children in the school shooting a long time ago. I forgot what school it was. Was it Sandy Hook? Sandy Hook at that school. One of the kids there had a mental health issue. So how were they able to get a gun? You're not able to have a firearm if you have a mental health illness, especially when you're 302. And that's involuntary commitment. You are a danger to yourself and others, and some other criteria that goes around that. No, it's still true. It's still true. If you have that on your and they ask you that if you have that on your records now, you can lie and say no, but they pull your information. Now, my sister has her license to carry, my niece has her license to carry, my daughter has her license to carry. I They all have guns. I just got my license to carry last year. I'm not really a gun person, but we're gonna need them. We're gonna need that amendments, the right to bear arms. So I went and got my license to carry, but I do not have a. I don't have a gun yet. I don't own one. And that was a question that they asked, and they held they held my application because I had I had a violent record. I was aggressive. But those things that they had, now I'm telling you, go too much of my business. Those things that they had on my record were supposed to be expunged or not um, supposed to be wiped out. So mental health and mental health illness are interconnected. They're like identical twins. Sometimes you can't tell one from the other, but if you listen to the language, you'll know. Poor mental health does not always indicate the presence of a mental health illness. And having a mental health illness does not necessarily mean you have poor mental health. I'm gonna let that drop on y'all for a minute. Mhm. I'll read it again. Mhm, mhm, mhm. Mental health and mental health is illness are interconnected. They're like Siamese twins or identical twins. You can't tell them apart sometimes. But if you listen to a person, you'll try to figure out if it's mental health or if it's mental illness. Poor mental health does not always indicate the presence of mental health illness. And having a mental health illness does not necessarily mean you have poor mental health. Someone may experience temporary poor mental health due to life stressors. What are some of those stressors y'all ask me? Mhm. A loss of a loved one, death, grief. The loss of a loved one, grief, it will bring on the sadness. It'll bring on the emotions. It'll bring on you feeling like this, the will to not live. I don't want to live if this person was not here. They held me down. This was my dad. This was my mom. This was my wife. But it's not depression. Job loss or career challenges. A job loss or career challenge will bring on anxiousness. If I lost my job, how am I going to pay my bills? You start to worry because that's what anxiety is continuous worry, but fear of the unknown. Financial stress. You ain't got enough money. You robbing Paul to pay Peter. Or major life transitions like moving to another place in the state. What we're going through now with us being in war with Iran. That's a major life transition. We haven't been in an active war in a while, and it hasn't hit us physically because I had someone call, I believe today, it was today, because ICE is now in Philadelphia. ICE is now at the Philadelphia International Airport. And this person was like, I don't know what I'm going to do. That's why I put up that, and go on my page and look at it, put up that information where the man said, if you have facial recognition on your phone, take it off. Take it off. Use your fingerprint or use a code or use a little drawing thing. Take the face recognition off your phone, because now when they scan your phone at the airport, they can now scan and have your face the face recognition onto their little computer, and it can see if you're a legal alien or whatever. Or they'll have all your business, all your information, your tax record, your work stuff. They'll have all your information. ICE has a special privilege to getting people's information really, really quickly. I don't want you to know none of my business. You won't pay these bills over here. And I'm an American. Now, remember when those, when you had those little games on Facebook a while ago, you scan yourself like you old and like you young, and they'll give you the old look of you. You scan yourself looking old, and then they'll give you the new look of you. Or they say, well, put your face here so we can make an emoji of you. Honey, that was all to put up in their little computers. That was all to put up in their little computers. Now we know how your face look, this look, that look, all put up in their computers. I never did it. You ain't scanning my face. I ain't slow. My ex-husband was a conspiracy theorist. He ain't played it. You better not do that, girl. Individuals with a diagnosis of mental illness, when properly treated and supported, can maintain good mental health, which means they can function in life even though they have a mental health illness or diagnosis. Just because a person has bipolar disorder does not mean that they can't function in life. Does not mean they can't be the president. Does not, sorry. They can live a productive and fulfilling lives with appropriate treatment and interventions. Interventions can be something like therapy. It can help individuals with either group therapy, couples therapy, individual therapy. It manages your mental health, like your emotional distress, the life challenges. It works by fostering self-awareness. That means you already know some issues that you're struggling with. Changing your negative thought patterns and developing healthy coping strategies. Now, if anybody ever goes into into therapy, you might not feel like you're getting enough out of therapy because you're not going in there telling the therapist what you want to work on. You're waiting for the therapist to help you with your problems, and that's not what they do, and that's not what we do. We don't give advice. We don't help you with your problems. We help you understand that you're struggling with something due to this life situation that's really it's from stress to distress. Now, how can we get you to cope with that distress to turn it back to stress, and then you're able to function? Like it can be the loss of a loved one. Quit your job. You don't want to do anything. How can we get you back up to your normal baseline? What were you doing before this? Some people say the healthy coping skills can be something like physical activities, deep breathing, mindfulness, social connections, setting boundaries. Hello, haven't we heard that a lot? Setting boundaries. Now, some of those things that therapy looks at is depression, trauma, anxiety, and relationship struggles. They call them interpersonal relationship issues, conflicts with interpersonal. The interpersonal means you and someone else, you or a group of people, you and your family, you and your employees at work, you and your neighbors. Interpersonal. You can't connect with anybody. You think maybe everybody's against you, all those things. DB, and I see the Leah, you all would be. I was going to go into all those models, DBT, CBT, all that. It's just too much. It's too much. I'm not trying to teach psychology. I'm trying to teach you how to actively live and not just survive, because you might have a mental health condition that turns into a mental health illness, and then you have this negative stigma about yourself and you feel stuck. This is all the purpose of the Trap Lounge, educating people. Coming on here talking about normal everyday things, but then having what is the impact of racial profiling? What is the impact of being an African American woman? What is the impact of being a single mother? These are natural things that we go through in life all the time. What is the impact of being a Black man being racially profiled? That messes with somebody's mental health. So unhealthy, what are some unhealthy coping mechanisms? Avoidance, avoiding things, pushing them away. Ultimately, when you push them away, you forget about them or avoid them, it causes them to resurface again. And next time is worse or possibly stronger than it was the first time. Same thing when you got a physical problem. Same thing. If you avoid going to the doctor, you have a pain here, and it keeps getting worse and keeps getting worse. But one day it just went away. And you're like, okay, I'm not going to go. I'm good. You find out you might have your appendix messed up. You might have a kidney stone. Don't avoid that. And the number one people that do it is mostly, and I said mostly, men. Men, if they arm ain't falling off, they eye ain't popping out their head, if ain't something ain't pussing up or bleeding, they're not going to the doctors. They're not going. Even if their teeth start falling out, they not going. Oh, that's just a tooth. It ain't, the bleeding won't stop. They're not going to and it's mostly men. They're not going to the doctors. Oh, Delia, you're welcome. You're welcome. I thank you for tuning in and helping me out. Another unhealthy coping mechanism is sleeping too much. It's another distraction, and it may feel better in the moment. Oversleeping has been linked to an impaired functioning and isolating, which has been linked to depression. Remember, a nice amount of sleep that we all need to get is at least 8 hours. If you're sleeping for like 15, 16 hours in a day, that's almost half of your day. So what are you doing? You're just there. And you're sleeping that long, you're not really brushing your teeth, washing up, eating. You're just sleeping. And that's still like avoiding and distracting yourself from whatever the problem is. Excessive drug or alcohol use. People have excessive drug and alcohol use for numbing feelings. You don't want to deal with it. That's with people with substance use. If they have any trauma in their life, they want to forget about it. They don't even want to think about it anymore. Numbing those feelings. Even if there's a death and a loss they couldn't take, they numb the feelings. It can be some PTSD, and PTSD can be for men that went to war. They just come back and they numb their feelings. In the movie, Set It Off, Dead Presidents, the guy that Chris Tucker played. You knew when he was in the field and they was killing people, and the guy cut the guy head off, and he kept the head for good luck, and he went there and boys, and he came back and he found out that I don't know what STD he had or STI he had, but he was doing heroin. He was numbing his feelings. Our young women and our men are over there fighting in whatever war, and they're seeing, and they have to shoot and kill people in order to survive. It's done in war, but having that on your conscience coming home, I had to shoot these people in this village, or they wouldn't move out the street so the or a bus can go through, or they put bombs in the road. It's a little kid there that can mess somebody up. I even told this to my husband, like, just imagine seeing something like that. Or like the police officer, and this was on the news. The police officer that went to the home, the person called and said, the person was dead in the house, or something happened to the person dead in the house. When the police got there, there was a body on a table, but the head was on the other side. Imagine going to a house look like that. You're going to a call of a disturbance, and you get there, and the guy cut his wife's head off. Her body was on the table, killed over, and her head was on the other side. Imagine walking into that. Imagine walking into a little infant baby that stopped breathing, that's turning blue or gray. Imagine walking into that. Imagine going to a scene of a hit and run, and there's a baby laying in the street, or a young person laying in the street. Imagine when you're in a gun battle with somebody shooting at you, and you end up hitting an innocent kid that just died. This just happened, I think 2-3 years ago. It was at a football game or something, and somebody was shooting, and the police, I guess, was shooting back, and it hit a child. I think she was 7 years old, and she passed. Imagine having it on your conscience. So feeling numb. Excessive use of substances, drugs, or alcohol can lead to severe health complications. So it's not just your mental health that's being affected. Now it's your physical health that will be affected. Now it can lead to complications of addiction, because you're just taking it recreational. I'm just going to take this for me to get me some sleep, or just to, take the tension out of my body. So then now it becomes an addiction. You need it in your mind. You can overdose, or you can even die from it. I do too. You probably a conduit, Dalia. Yeah, you feel other people's emotions and things. It's very, very sad and difficult. That's why for me, and the work that I do, I pray every morning. And on Sunday, everything that I hear from Monday to Friday, I take it to the altar at my church and leave it there. God, help these people. Even if I can't remember their name, God already knows what's in my heart, because he heard it with me. Help these people through this. Help me so I can be stable enough to do my job. This is a good one. Impulsive spending. I used to do that. And impulsive spending, you get a big burst out of it. It feels good, like, oh my God, I'm about to buy them 5 pair of shoes, girl. That's $200, $400. Now you got the money. But the money is supposed to go to something else. Your rent, your food. Now you got these 5 pair of shoes. They look fabulous, honey, but you can't eat. You gotta tell the mortgage people that you'll pay them back, and now you got a late fee attached to that. So it'll cause a lot of financial problems for you. Over or under eating is another poor coping skill. Emotional eating. If you get into an argument or something, you would have to get you some ice cream, and you sitting there just eating it. Like Mr. Clump on the Clumps. Remember when Jada Pickett, I forgot her name, she broke up with him. He went home and was just eating that ice cream. Or under eating. You stop eating, you don't have no appetite, you don't even want to drink anything. That can be very, very dangerous. Yeah, I had the impulsive spending thing. It was in my depression. I had that. And my best friend, here tonight, Deb Burke, she would have told you, honey, I used to have shoes from the floor to the ceiling. When I went, now I just didn't buy shoes for me. I bought shoes for my kids. And then when my husband was like, well, you can't just keep buying shoes for them. I bought shoes for my kids, me, and my husband. You get two, I get two. You get one, I get one. It was a mess. It was a mess. Delia said, I think I'm depressed. She told you. So what did your therapist say? Did she ask you why? What's going on in your life? Name the symptoms. How are you feeling? Describe it. So reducing the stigma. How do we reduce the stigma from mental health and mental illness? First of all, we got to recognize that mental health is universal, while mental illness is specific. It is for diagnosable conditions. We can help with reduce the misconceptions and stigma surrounding the mental health conditions. Mental health conditions is basically the things that you are high stress with, but you're okay, you're able to function. So I can say, okay, you say you're depressed, but how is that affecting your well-being and your life? Are you able to get things done, run your errands, go to your doctor's appointments, take care of yourself, making sure you're doing all your ADLs, your activities of daily living, which is making sure you clean yourself, brush your teeth, feed yourself, take care of your house, take care of your pets, water your plants, are your everyday functions okay? Because if anything is missing, like, oh, I just, I ran out this morning, I didn't brush my teeth, but I put some mouthwash in my mouth. Oh, okay. Okay. But if you tell me I ain't brushed my teeth for 3 days, and on after the second day, I didn't put no mouthwash at all, then now we're saying that your hygiene is a little bit off. You might have a little smell, people might not tell you it's just your breath smelling, but something's off. Yes, she asks some things, but we talk like I talk with anyone else, but she supports me through these times and acknowledges my pain. Is she helping and the trauma and the problems? And see, that's the thing. You can talk all day in therapy, but is she helping you to learn and cope with knowing those things? The trauma is your past and it shouldn't be affecting your present. And how can you, heal and process your past problems? Because they always going to come up and it's going to push you into your present day issues with relationships now and work now and how you're dealing and attaching yourself to things at this moment in time now. So, and again, in therapy, you're going to talk about those past issues, the troubles, the life experiences, the situations, but you shouldn't have them bringing into your present. And if they brought into your present, how can you deal and handle them now? So when you move through that life cycle, your past won't be coming back to haunt you. That's just a swift, easy way to say this is how therapy is going to work for you. There needs to be better communication. See my shirt? It says check on your strong friends. And it's crossed out and it says no, check on everybody. Everybody. Remember, because everybody has mental health. Not everybody has mental health illness. So if it's better communication, when you're using precise terminology that facilitates clear conversations between healthcare workers, between patients, between the public about your mental health or your mental well-being, your mental health, and then if you're having or have been diagnosed with a mental health illness. Okay, you have depression. Let's talk about that. How is it affecting you? How can we help you get through it? Cope through it for you to move on in your life. Because you again, if you were diagnosed as a diabetic, and you don't have to take the medication anymore, it's still going to be in your medical history, past history of diabetes. If you don't feel like you have depression anymore, it's still going to be in your mental health record, past history of depression. If you had a suicide attempt, it's, you don't feel suicidal now, but that's going to be in your history, past suicidal attempt. And sometimes they'll say, what was going on in your life that you attempted, that you actually try to go through and react on your thoughts. And so they'll understand, what was going on in your life. So, you'll talk about, that's one of the key things that you'll talk about and try to, get over. Mental health may be addressed through wellness practices, stress management, and lifestyle changes. This is where your self-awareness comes in there. You have to be aware of the stuff that's stressing you out, and you don't want it to linger. So now it's distress. When you're stressed out, you might feel frustrated or overwhelmed. And that might be a crisis. There might be a mental health crisis. But when you're in distress, you really can't function. You're distracted. You might make those impulsive thoughts or behaviors really quickly. You lose track of stuff, appointments, dates. You might burn a pot or two. Mental illness typically requires, again, professional treatment. You can see a therapist, you can see a life coach, you can see a psychiatrist, you can see a psychologist. They have some gurus out there, what they call them, motivational speakers. They have, you can go to those classes, and depends on what you are searching for and what you are looking for. And sometimes I'm gonna just tell you, honey, talk to God. Okay, He know it all. Talk to God. I had mentioned before, and I'm going to put the link up in there again. Mental health first aid is a good class to take. It breaks down things in layman terms, meaning terms that we can understand. And mental health first aid is a whole day of class, but you can do it online by yourself. You can select your own date. So the first 4 hours you're learning through the webinar and answering questions, and you're looking at a lot of videos on a webinar. The rest of the 4 hours you'll go through with the mental health instructor, and they'll give you different scenarios, and you're talking about stuff. I think there is a slight test that you take. It's fairly easy. And you get a certificate for 3 years. It's free, guys. It's free. Philadelphia is the only one that has the mental health first aid training, period. Period. Philadelphia, you will only see the mental health first aid training from Philly. It'll give you resources on how to help people, resources on how to help our unhoused friends, resources on how to help, someone that's pregnant that needs shelter. They'll give you all those numbers, and you keep it in your little toolbox, as they call it, with I say my phone or something like that. It helps you. It'll give you a better understanding. You'll really be a pro at understanding mental health and mental illness. Yeah, Dalia, I'm gonna put the link to mental health first aid in the chat. Again, you can just go on here and you can check off if you want. It says the adult mental health first aid. It says children mental health first aid, but you can combine it together. That's going to be a little long class. But again, you get a 3-year certificate because now you're a mental health first aider, and it's a wonderful class to take. I'll put that on the chat. I'll also put in the chat, the comment section, some resources and some other things that'll help you out to understand mental health and mental health illness, and just some coping strategies and things for you guys to have. So that is the show. I'm hoping to have my guest on next week. I forgot what I phrased. I thought I wrote it down. I forgot what I phrased the topic on, but it's supposed to be a male on. And I was telling my husband today, when you're on live, you see I'm on here, and I've been doing this for a while. Even when I'm on 24/365 praying, I still get anxious. I don't know what I might say that might offend somebody. I try to be non-biased with everything, and I guess that's with my field. But coming on here is not easy, especially then coming on here and talking about something personal in your life. But then I say God gave you that platform to overcome it. Now you got to help somebody else get through it. So I hope when I get this, he has to figure his schedule out. I hope within another week I'll have him back on here. And my lady, Miss Lawson, I'm going to have Miss Lawson on here as well. She has an organization. Please, Miss Lawson, put that information in the chat. So she something's going on March 28th at the Alany Branch Library at Fifth and Tabor. That's at Fifth and Tabor, I believe the library is. She's having an event there, and it's free, and it's awesome. So I'll be having Miss Lawson on maybe the week after Easter. Easter's coming so fast. It's April 5th. That's in another week. All right, guys. I enjoy these talks. I enjoy these sets. And I enjoy y'all talking back to me. I love you, Mr. Leah. I enjoy y'all talking back to me. I hope you guys have a good night, a safe night. My name is Kimble Evans. I am your trap therapist, and you have been on the Trap Lounge. Have a good night, people. Okay, YouTube.